I am doing my speech on the controversial issue of PTSD or post-traumatic stress disorder. I'm going to scan my 5 audience members. PTSD or post-traumatic stress disorder is characterized by anxiety disorder. PTSD can affect many people, victims of criminal acts and those called to duty, such as military servicemen and women, law enforcement, and even government contractors in the private sector, are left with a negative impact on their mental stability. Specialized services have become a great need for men and women who are returning from home, from duty, and being traumatized by the experience that they are being left with to endure. There's also a great need for the many rape victims and victims of violent criminal acts that are also being endured by so many people. People with PTSD are being left on their own to deal with struggle and the effects surrounding this disorder. Because so few resources and outlets are being offered, our veterans and victims have turned to drugs, whether it be prescriptions, alcohol, or street drugs to remedy their situations. For this reason, there is a great need for specialized services that will treat those suffering with PTSD and the symptoms they will endure. With millions of people suffering from PTSD, and with it being a fairly new disorder, there is a need for specialized services to be treated. With a lack of trained professionals, many suffering from PTSD are never diagnosed. This can be a result of PTSD appearing to be another disorder, such as bipolar disorder. The symptoms may not show up immediately. If you catch it early, you have the opportunity to treat it before it manifests in a major way. Anytime a person experiences trauma, it affects them and everyone around them, including their loved ones. Often overlooked are victims outside of the military that experience trauma. Such traumas could include violent crimes, natural disasters, school shootings, and bullying. Critics of this position often do not recognize PTSD as a true disorder, which can prohibit specialized services from being implemented. I believe that PTSD is a serious issue in our community, dealing with our military and medical military personnel. From a personal standpoint, I have seen how it has affected some of my close friends and how their personalities have changed from being in the military environment overseas. I believe that more help needs to be offered and provided to assist with rehabilitation from this disorder, because there is arguments of debate on whether it is a true disorder or just an excuse. PTSD has affected about 7.7 million adults, and it can affect children or anyone at almost any age. It is more likely to affect women than men. It is also considered to run in the family at times. Many people do not like to admit that they are experiencing this due to fear of looking weak and out of control. It is often accompanied by substance abuse, depression, or anxiety disorders. Most PTSD victims are members of the military. They have been exposed to very traumatic events, being in war zones and combat. PTSD is also present in victims of crimes, rapes, bullying, car accidents, plane crashes, child abuse, and disastrous events that may have taken place in their lives. Veterans that return home from Iraq and Afghanistan often sometimes have mild to moderate brain injuries that can lead to PTSD also. Explosions can cause rattling in the brain and can cause major brain complications, which can lead to PTSD. Many of the medical personnel whom have witnessed the agony and pain that many of the veterans have to endure, many times also show symptoms due to having been in the experience with them and over again. Military personnel and war victims brought the disorder to the public attention because so many of them returning home depressed and emotionally checked out with people around them. We as family members of war victims veterans, victims, victims of bullying, and people of many different traumatic experiences must get involved in helping our family members to overcome these situations, to support and assist and motivate them to get help with their problems. We need to do anything possible to encourage therapy and treatment for this disorder. PTSD can be overcome with the help of mental health facilities, institutions of higher education offering training and certifications in PTSD, and peer and counselor programs that the victims are able to turn to for treatment. Volunteers of PTSD who have been through this disorder and can provide help and support on trying to overcome it. Someone or a place that they are able to go to for support, kind of like people with addictions. There can also be camps, nonprofit organizations, walks, and fundraising events to help raise awareness. If these victims are receiving help from people who are suffering from the same thing, they will feel more comfortable getting help for it and recognizing that they need help. The community has to get involved because the disorder affects not only the person who has it, but the people who are involved in their lives. PTSD makes them emotionally detached, angry, depressed, and withdrawn from life. Many of them turn to drugs and addiction, trying to remedy their feelings of anxiety. The benefits of PTSD resources. The benefits of having these resources will attribute to a more stable community and environment. Being able to have somewhere to turn to when these traumatic experiences happen will be the difference of having so many homeless veterans or criminal victims in a state of depression or drug addictions. If we tackle the main issue first, we will not have to deal with the outcomes that may take place due to this disorder being able to manifest in the first place. Voting and government funding has to happen to be able to employ mental professionals for any person dealing with PTSD. We must volunteer time, talent, or treasures from anyone, whether or not they have been through this disorder, and we're able to overcome the problem so that it will directly affect the people who are presently coming home from war, overseas, or the many people in traumatic situations. PTSD victims can have a constant level of support as soon as the situation takes place and on a constant basis with an endless amount of resources to turn to immediately. Due to over the 7.7 million people, PTSD has become an epidemic in our country involving the military. PTSD has also affected the personal lives of people due to economy, crimes, natural disasters, and other traumatic events that may have been out of control. We as a community need to realize the importance of help for the many victims of that disorder and support ways to treat and rehabilitate our family members and community. With the research and suggestions that I have discussed, we should be able to assist in the progress of recognizing and offering help to the many victims of PTSD. And that's the end of my speech, and I'm going to view my 5 members. Thank you.